Good morning. My name is Jared Morrison. I'm an organization development consultant with the Learning Organizational Development Unit for OSU Extension. I'm excited to welcome you all in today to our series ACEL to Extension. This is a great partnership that we've had between OSU Extension and the Department of Agricultural Communication, Education, and Leadership. We've had a full series and we're into our second series now, and it's been very well received. We've heard some great comments from our ACEL personnel and as well as our extension personnel. So we appreciate all the work and time and involvement. So thank you all. I did want to share our web page link that is now in the chat box. You can use that Go link to access our page, to see recordings from previous sessions, as well as register for any upcoming sessions. So please take some time to check that out. And we're excited to welcome you today for, as you can see on the screen, the topic Whole Farm Planning for the 21st Century, Integrating Healthcare, Health Insurance, and Childcare. And I'm excited to introduce our presenters this morning. We have Dr. Shoshanah Inwood, who is an assistant professor for the School of Environment and Natural Resources. We also have co-presenting with her, Dr. Joy Rumble, who's an assistant professor in the Department of Agricultural Communication, Education, and Leadership. So Shoshanah and Joy, I will turn it over to you. Thank you.
Great, thanks, Jared. So thank you all for coming today. Shoshanah and I are excited to talk to you about this topic. And this is really an area that Shoshanah focuses on a lot. And I've been fortunate enough to tag along with her and do a little work in this area as well. And I think it's something that we're going to continue to see evolve and grow over the coming years. So today we have just here a short little agenda. We're going to set the stage a little bit, talk about the issues and what some of the research says around these issues. And then we're going to have you guys break out into some breakout rooms and discuss what we can do from an extension perspective to help our clientele. And then we'll do a little bit of a debrief, share some resources, and wrap up.
Thanks, Joy. I was gonna hop in right now and really talk a little bit about some of the research that we've been doing around healthcare, health insurance, and childcare over really the last 10 years, and talk about how these issues really fit into farm risk and resiliency. One of the things that's really interesting about this and why I'm so excited to also be part of this ACEL to Extension is that these issues really cross-cut across all extension areas. They really address both ag and natural resources, family consumer sciences, 4-H, community development, right? So this is a really, I think, unique opportunity for all of us within Extension and within the College of Ag to really bring our insights into addressing these very complicated problems. And Bonnie Braun, who's I see is joining us today from University of Maryland, one of the ways that she phrases this is that these are private problems, but really public issues that affect all of agriculture. So with that, let's dive into a little bit of some of the things that we found over the years and why this is so important. Joy, next slide, please. So when we look at the way that we focus and have conversations around economic development in the food and agricultural sector, there's a lot of funding that's been invested both at the national level and the state level. Really, most of the programming and grant funding tends to go towards issue around access to land, get access to capital, how do we build labor and skills within our food and agricultural sector, and how do we get access to market and become much more savvy entrepreneurs, all of which is incredibly important. But it tends to really ignore a lot of the household level issues that we really know are so important. Next slide, please. If we really want to get into holistic farm planning, we really have to address how these issues of healthcare, health insurance, and childcare affect both the enterprise itself, right, and its ability to withstand shocks in the system, how it affects the human capital of the farm family and farm workers, and how it ultimately affects both farm success and rural development. And I think what's really interesting is right over this last year, just as a quick show of hands, how many of you have thought about or faced an issue, or you really had to think about either health insurance, healthcare, childcare, or even elder care? Maybe just with a show of hands with your boxes. If anybody's had those issues, okay, see at least one person. Maybe I see some heads shaking. Yes. Yeah. Right. So I think that these are all issues that we really all relate. And I put a couple of the resources down here just for some of the academic literature, but I wanted to just give you kind of a very high overview of what some of our findings have been. Next slide, please. Okay, so first we're going to go over and talk about childcare and farm families. I myself have 2 young children, and I look at these pictures and I'm just like, I want to be these people. I mean, they just look so happy, right? In the garden, right? And on the farm, watching the carrots, and look how good the kids are. Next slide, please, right? And we often see these images of when you have a baby, look how we're celebrating. It's this beautiful moment. Next slide. And then we get home. Right. And so to some of you, maybe this looks a little bit familiar, where then the reality sets in, where it's really complicated when we've been juggling our lives, our careers. Do we have family nearby or don't we have family nearby? And then we also find out that kids are really expensive, right? Whether you're buying diapers or, you might need formula. Childcare costs are huge, right? It costs more to send your child to daycare than it does to send them to a public 4-year institution for college for the first 4 years of your life. So there are these real financial issues and real stress that occurs within the household when we welcome that joyous bundle into our home. Next slide, please. Right. And so when we went out and we said, well, there actually isn't a lot of research out there actually assessing how much of a problem it is, because also on farms, we have this vision. It's a beautiful, idyllic place to raise your child, right? And they can run free and be barefoot and so many benefits to raising children on farms that we know. But what was interesting is, like, when we asked folks around the country, do farm families actually experience childcare problems? It turns out that they do. And when we like to sort out by different demographics, we find that this is a problem for everybody. It doesn't matter if you're a man or a woman, if you're a multi-generation farm or a first-generation farm where your family has no connection to agriculture, it's a problem. But what we do find is that there are some slight differences, where what we tend to actually see is that for first generation farmers, and also really for women, it tends to be slightly more of an issue, right? And when we think about this next generation, who's going to be our next generation of farmers, a lot of times folks are setting up where there's great soil and access to markets, and they may or may not have a community connection or a family connection nearby to help out with some of that childcare. Next slide, please. So what we've also found is just some of the updated data is that in COVID, all right, this is from some of our colleagues over at the National Farm Medicine Center, and they just did a survey out this summer just to kind of take the beat of how are things happening with childcare. And what we're finding is that childcare has always been stressful. It's always been expensive, and it's also very difficult to find places to put your children for childcare, of who's going to watch your kids. And that issue is exacerbated in rural areas. But with COVID, this issue has become even more extreme, right? And this has become part of our national conversation with childcare centers closing, with issues with older folks needing to protect themselves. So it's really disrupted how our whole ecology of childcare that was really just hanging on by a thread anyway. Okay, next slide, please. So then the other area I do a lot of research on is really looking at this issue of health insurance, and how does healthcare and health insurance affect economic development and quality of life in the farm sector. And one of the things we know is that farmers really wear 2 hats when they're making health insurance decisions. One is for themselves and their family, and the other is as an employer. And we're going to focus mostly today on the individual and family making decisions, but we know how important it is for thinking about farmers as an employer. Okay, next slide, please. So back in 2017, we had a national survey and asking farmers about their health insurance status and how it was affecting their lives. And this is just some of the data that I wanted to share with you. And one of the things is that we know is that farmers as a whole tend to be really well insured population. Actually, they're slightly better insured than the general population. And most of that is because they're insured through off-farm jobs. Okay, so then you have to think about, right, you've got 2 jobs, not just your farming job, but somebody in the household is working off farm. What we also found is that not only are they well insured, but over 30% have more than 2 plans operating in the household. And I don't know about you, but my own insurance plan, I'm not sure how well it even works, even being at OSU with a great employer, right? And then having to navigate 2 or more plans within the household is a lot to think about and navigate. Next slide, yep. And what we also found was how important health insurance is as a risk management strategy. About 3/4 of the sample said that health insurance is an important risk management strategy. And we talk a lot about risk management, right? Usually in agriculture, we're talking about crop insurance and thinking about risk from that perspective, the production system side. But what we're seeing is that our clientele is really thinking about this also from their health side as a risk management strategy. Next slide, please. What I want to also, if you could hit the animation button there, sorry, Joy, just one more slide. One of the things is that we see is that farmers, families tend to have really good prescription drug coverage. Dental, not so great, only 44% had dental insurance. But what's also really interesting is 36% had vision insurance, right? And we're talking about an aging population where the average age of farmers is 58.9. And I know a number of you work in the area of farm safety, right? So you know how important it is to be visually aware when you are driving very large equipment or dealing with very complicated equipment, right? This also can really contribute to some of the farm safety issues if you are going and only able to go to the doctor for new glasses every 4 or 5 years, okay? Which is what we also heard from our sample. OSU has been doing a lot of work about farmer mental health issues. And what's really interesting is when we surveyed our sample, about a third of our sample, 33%, didn't know if their plan even covered mental health, mental and behavioral health, right? So when we talk about being able to access care, if you're not even sure if your plan does or doesn't cover it, that can become a barrier, right? Okay, next slide, please. So some of you may have heard about the 2019, or we're actually calling it the 2020 Ohio Farm Poll that Doug Jackson Smith and I sent out last year. And we were able to capture data from around the state. And we were really interested in what were the factors affecting farmers in 2019, which if you remember so long ago was a really stressful year, lots of rain. We also had trade wars going on. And what was really interesting is when we asked farmers what their major source of stress was, well, besides the weather, the cost of health insurance, right, came in that next year and was equally as important as farmland costs and market prices and farm input costs, right? So again, something that we don't often think about with affecting farmers, but we see just how important that is. Next slide, please. What we know nationally, and we also saw this within the Ohio Farm Poll, is that 64% of our farm population has a pre-existing health condition, and 40% say that they have a health condition that makes it hard for them to farm. Right. So when we're talking about farm profitability and human capital, and I know those of you, especially who work in family consumer sciences, know how important it is, right, for a healthy body to be productive, to be more resilient, right, to be able to address any risks or disruptions that are happening, right? Farm profitability is directly tied to your health as well. Okay, thanks. And then when we're thinking about this next generation, again, less than 2% of our farmers are, less than 2% of our population is farming, and we're really concerned about who's going to be this next generation. Well, what we're finding is that actually health insurance is really actually tied to farm succession and land transfer. What we see is that in terms of how it affects the family's finances, over half of the sample is not confident that they're able to pay for the cost of a major illness. And almost half, 45%, are concerned that they're going to have to sell the farm to address a health-related issue. Right? So this is really serious. The other part is that what we know is that health insurance and childcare really change along the life course, right? So your needs are going to be very different when you're young, have no children, when your children are young, as you're actively aging, and then when you are in an older phase of your life course. And we know also, if you can hit the next slide, Joy, thinks, is that also some of our access to things like an ability to afford healthcare and childcare are going to also be affected by what's happening in our family. Like if a family member dies, if there's a divorce, if you lose your job, right? So there's also this need to constantly revisit these issues and how they're fitting into your farm and household enterprise budget. And those things are really what we wanted to bring today, is that there's kind of these are big issues, but they're also issues that you don't just look at one point in time. They need to be looked at as the business and the family continues to evolve. So with that, I'm going to turn it over to Joy.
Great, thanks, Shoshanah. And so now that you have had a chance to start thinking about the issue of healthcare and childcare within farm families, we're going to have you do a little bit of case study work, and Shoshanah is going to drop a PDF into the chat box. And once that's there, I would like for all of you to open it And this is really going to be your guiding document as you work through the case study. You will find instructions on that case study, as well as the case study itself, and then what you need to do to prepare for discussion when we come back. And so I'm just trying to give a second here maybe to get that. And you'll have 15 minutes to work in groups together before we come back. All right, should be coming. I see it on my screen. Should be able to access that in the chat box. So if you can go ahead and download that so it is open. And then Jared, if you could please send participants to breakout rooms, work through the case study in your group, and then we will see you back together here in about 15 minutes.
I don't remember what group I was in.
I know I didn't see the number either.
I was just gonna say group one had Jessica, Ronco, Lisa, Sabrina, Viviana,
Okay,
two Jessicas. Yeah.
then that would be my group, and I agreed to report out.
Awesome.
So I'm Lisa Piper, and I work in ag safety at Ohio State. And our group felt like all of this was a very common scenario. Sorry, my puppy's barking. Just a second.
Those are the other children that we all have, right? So.
Okay, I put her outside. And so really the childcare issue we discussed, we feel like is a larger, broader issue. It crosses not only the agricultural sector, but all sectors. And our recommendation would be to connect up with Extension that could then connect you out to organizations like FSA, Jobs and Family Services. Somebody right at the close, as we were closing out of our section, mentioned a farm account management book that helps kind of process and go through and do worksheets for the business management side.
Awesome. Awesome. All right. Anything else, Lisa? Are we ready to go on to the next group?
I think, well, I hope I caught it all, but now I have another barking dog, so I'll go on.
Okay. All right. Second group. Who's the reporter for the next group?
Okay, I took the notes and I said I would just report then. So for the first question, some of the things that were mentioned was that they didn't seem to have a long-term financial goal for themselves, for retirement, for health coverage, and that they should have planned ahead of time for how to reinvest some of that money, not just back into the business, but into themselves. Sarah mentioned that farmers, when they budget, they tend not to plan for themselves or think for themselves and what they actually need. And one of the questions we identified is, what is stopping Ryan from switching full-time to construction and then doing part-time farming to possibly get those benefits if they are available? Same thing with Jessie with her full-time. Would she get benefits that could cover the whole family and possibly be able to pay for childcare? For the second one, some of the information that we identified was the SMART program, creating budgets for not just themselves, but for their business. Sarah also identified that they have a lot of different things going on at the farm, and maybe they could simplify the diversity of which they produce to kind of help with their budget as well. And then also they would need to look into how exactly are they paying and providing for their part-time employees. For question 3, Penn State has an organic and small farm budget plan that they could look at. Again, the SMART program could maybe help them out, farm succession planning. And something else that we kind of were debating right when the time ran out was the daycare problem in the rural areas. If you don't have those family connections, sometimes it can be very, very difficult to find childcare. I believe it was Jana pointed out, or maybe not Jana, but somebody pointed out, sorry, that there's the 211 help number that could also be utilized if it's available in the county to find the different places. And also the health department can help you find people who are licensed for childcare.
Awesome. Thank you. Yeah, no, I'm feeling the childcare struggle myself right now. My son's school is closing for good tomorrow, and we just found out last week. And
Oh.
so we're like scrambling to find a new place for him to go to preschool. And we're closer to Worcester, and it's a challenge, definitely, in those rural areas.
My daughter's on 5 different daycare waiting lists right now.
Wow. Wow. Yeah. It is brutal out there in the childcare world. That is for sure. So hopefully that case study was helpful in getting you all to think about how these topics apply to your own jobs and your clientele. Now we're going to have you respond to a couple of poll questions. And Jared, if you could launch that first one, please. So this one we just want to kind of gauge what topics you're hearing most from your own clientele. Have you heard similar stories to the one that was in the case study among your clientele? So if you could respond to that, we would greatly appreciate it. And really, these poll questions are going to be helpful in helping us to form future research and grant proposals so that we can identify needs in Ohio among our extension communities. So
just a couple more seconds. We got a handful that
yep.
could respond if they want. All right, I will close that one.
Awesome. So it looks like the majority, 67%, are hearing stories of both among their clientele. Great. All right. Next poll, please.
Great, that should be showing.
Okay, so the premise behind this question and the next question is that typically whole farm planning tends to leave out the issues of healthcare and childcare. So we just wanted to get a perspective from you all on whether or not you feel it's important for that to be included, especially among your clientele and their needs.
And we'll use just 5 or 10 more seconds, just a few more people. All right, close this one, share those results.
Okay, it looks like over 80% or so agreed or strongly agreed that healthcare should be included in whole farm planning. All right, and then the next one, this is the last poll question.
All right, that should be up as well.
Yep, this one is specific to childcare.
Do about 10 more seconds, just a few people left. All right, I'll go ahead and close this one.
All right, so that one, the math is easy. 70% agree or strongly agree that it should be included in whole farm planning. Awesome, so thank you for responding to those. Like I said, those will be really helpful to us when we start to work on future grant proposals as well as future research. But to continue for today, we wanted to discuss with you a little bit more about your experiences with these issues in your jobs and among your clientele. And so we're going to hopefully have an open discussion here just for just 3 questions or so to see how this looks in extension throughout the state and how we can better support you and your clientele and your jobs. And so this first question, do you feel adequately prepared to advise clientele on these topics? And so we'll just open the floor for discussion. And if you guys could comment on that and why or why not you feel adequately prepared, or how those conversations usually go with your clientele, it would be really useful and helpful, I think, for all of us to learn how maybe we can do a better job in this area.
This is in regards to childcare and healthcare.
Yeah.
0 on childcare. I don't like, does extension even have a role in that? Like, because we were talking like we need help with childcare. Like, so that's all confusing to us as we try to explore different options. So when we had the question, like, what can extension do for childcare? We were like, not sure. So not 0 on childcare. Healthcare, I mean, I think everyone has like basic knowledge of where they can go to look for healthcare. Obviously starting with your employer, if it, if you don't have that like second job or that option, then like marketplace or things like that. I think there's like, maybe for myself, like very small, very limited knowledge on healthcare too.
The question I have too for extension and childcare, we kind of learn through the community, well, so-and-so will watch your kid for $3 an hour. But if we were to recommend those people or at least give that information out, is there a liability thing if they're not like licensed and with the health department and stuff like that?
Good point. And good question. I don't have the answers to that. Yeah, good. Any other discussion on this question?
I think on the childcare side, one of the potential resources, while it won't help probably during the day, I partnered with our 4-H educator, and we are offering the Safe Sitter program to certify those youth. And it's a full certification where they'll have their first aid, their CPR. And so I think that's one option just to think about across our counties. Again, that won't help during the day. I also think when you connect, we shared we don't have access to 211 in our county, but we have a new WIC director, and that's one of the things they're helping to identify is how do we create that list while they're new, they don't know, some of those questions. And then I think on the healthcare side, where we really lack our focus sometimes is those 100% employed on the farm, there's no off-farm income. And where do you get those resources? And Shoshanah, I know you shared with us that, I believe it's called the SMART program, that while that's a basic, it's something that I think every person should go through to start to understand even how healthcare operates, because I think it's confusing when you are healthy and you're not using your healthcare plans until you get an illness or those things. And I think it's in part important just looking through those things.
Awesome. Thank you. All right, so let's move on to the next question. And you guys have mentioned some different resources like the SMART program and 211 and the Smart Sitter program. But what other resources have you used in your job to share with clientele that you could also share with the group? Are there any other resources that you've used to advise on these topics?
One of the things I use is actually helping them develop a business plan. And I do a series of small meetings one-on-one with that family, especially if they've already started the business. And it's kind of hindsight is 2020, but going back and thinking through that and say, did you think about these things? Did you think about putting healthcare into that budget? I think the childcare one is obviously if they don't have children, you don't necessarily budget for that, but going through and saying, how much do you need to survive as a family? And are you adding that into your budget and looking at those what ifs and making sure you're covering all those areas? But sometimes the unbiased source sitting down and asking those questions. And there are some great business planning documents. I go back to teaching high school agriculture, that it's the things we did with the basics when students were setting up their entrepreneurships. It's no different for those adults. It's just a little more in depth.
Mm-hmm. Is there any specific business planning resources that you direct them to, or a favorite that you use?
There are 3, and I will tell you, I haven't used them since COVID hit because I haven't done as many one. I can't tell you what they're called, but I know I have them saved on my computer. I'll try to find them and share those.
Awesome. Thank you so much. All right. And then our last questions for the day. What kind of resources do you all need? And what kind of resources does your clientele need regarding these topics? And so I think we've identified one thing is like, where do we draw that line of, if we recommend somebody as their liability there, we probably need some resources around that. But what other resources are needed?
I definitely think a kind of a whole listing of childcare resources, ways to different agencies that would be able to assist in navigating, finding those, some kind of childcare, maybe not fact sheet, but something similar with all kinds of resources listed.
Awesome.
I think a list of programs that is offered through extension throughout the state, like some of these programs I've not heard about. And so is that something that I can do in my county? Is that feasible for me to do, or, something similar?
Yeah, I think that's a really good idea because, I think sometimes it's easy to get in our little silos and not realize what somebody might have found a solution to this somewhere that we could adopt it in our counties or in our areas, but we just didn't know about it. So I think, conversations like this are the start of that, definitely. And that's why we wanted to ask you guys these questions. Any other resources that are needed for you to do your job better and advise on these topics, or any other resources needed by your clientele?
I think one of the things that I went to a Farm Bureau program in early 2020, and they talked about at the age of 40, if you are self-employed, how you should be thinking about that, the nursing home benefits and those type of things. And I'm like, oh, I've never even, we didn't think about those things, but especially if they're 100% self-employed. And I think that's something that maybe when you're self-employed, you don't think about those things. You're thinking about, I just need that healthcare option. And so I think in our farm succession planning or communicating with farm families programs and how we have those farm family meetings, that's another area that we're not covering that we could use resources in.
Good point. Definitely.
And all these programs would be wonderful. And especially if you worked with the extension pubs. I know our accounting books go out very readily for the farmers. They're visual people. They need to be able to see how it's going to help their bottom line and help them long term. So if you do have something, to have something where they can like, okay, here is a bulletin or some type of handout that we can give them would be also helpful.
Mm-hmm. Yeah, definitely. I think that's really important. And I, as I listen to you guys share, something that I think about is I've heard people within my own family say that, well, maybe my financial planner asked me about, setting money aside for nursing home care and stuff like that. And I said, well, I'm never going to a nursing home. And so I think sometimes we have that resistance among our farm populations too, where, well, that's, or just people in general, that's not going to happen to me, or I'm never going to be in a nursing home and that kind of stuff. So I think there can be barriers like that as well. But definitely finding documents and preparing documents that are visual and match their needs and address those barriers is going to be really, really important. So we have about 8 minutes left, and I'm going to turn it over to Shoshanah, who's going to share with you some of the resources that are currently available and talk through some of those. And she has a couple of PDFs that I believe were emailed out to you in advance, but she's also dropping those in the chat box as well. So there are a couple of handouts that have lots of resources on them. And then we'll take a few questions at the end if there's any questions that remain.
So thanks everybody for really sharing your insights into the case studies and the types of resources that you've been using, but also the needs for them. And I think that this is a really challenging area because there just is not a lot of resources compared to some of the other topics that we commonly deal with. So we wanted to share with you some resources that have been developed. I will just say that your feedback on these is always helpful. And I think that this is a new area that's constantly being developed. So as I mentioned earlier, I lead the USDA funded Health Insurance, Rural Economic Development and Agriculture project. And some of the resources that are available on our website, these are all hyperlinked, and also in the PDF, they're hyperlinked, so it should be really easy to get to them. Depending on the type of programming that you might be interested in doing, we have a number of one-page research finding briefs. So it's like if you're trying to set the stage and kind of talk about maybe like your county commissioners or some other decision makers, why this is important and why we're talking about this, or to farm clientele, like that may help you draw a couple of statistics. There's also a 6-minute video that was professionally produced, because if you're like me and you'd rather watch the video than read a 12-page report, it's actually how it's pretty well done. So that's another way that you can use it to include in your presentations. Jake Jacobs who's University of Vermont and part of risk management there, created a really nice document about advisors' questions to ask farmers and ranchers. So as Sarah was saying, what are some of the key questions that you might want to be asking when you're talking about planning? These are some examples of questions, because I know sometimes it's hard to talk about that in the abstract, but these are the actual questions. And then there's also a 3-minute video about health insurance and farm risk management that's available on the site too, that you might be able to use together. And then, as folks had mentioned, the Smart Choice and Smart Use Health Insurance Consumer Resources. These are for a general audience. I think Jesse Ketterman was on earlier from University of Maryland, and Bonnie Braun, who helped develop this. So that's another really great resource. As Sarah was saying, that even I've learned a lot just by using it for myself, as you can compare plans and how you can integrate your household budget, right? So that's the thing, right? We're talking about folks who've got businesses and households, and how do we have tools to integrate those two? The next slide, please. University of Delaware Extension also has had an active project called Linking Farm Vitality and Health. So there's a number of resources available on their website. They had done a special issue within the Delmarva Farmer, which goes out to all farmers in Maryland and Delaware, and it's 16 pages of short articles that might be useful if you wanted to pull some of those and put them in some of your newsletters or things like that to raise issues. They have a nice document about farm operations and healthcare insurance options. So again, talking about the different varieties out there. There's also a really great tool that they've developed called How Healthy Is Your Farm, which is a short video that talks about connecting your personal health with the help of the farm operation. And they also have a stacking game that they've created that is something else that you might be able to use with your clientele. And there's also a self-assessment that you can give to your clientele to take, where it's 13 questions to help farmers determine their readiness for a personal health crisis. And then recently with coronavirus, they have a nice short article about what to do if you've lost your health insurance. Because one of the issues that we know is that the majority of farmers get health insurance through off-farm work. And because of all the layoffs and furloughs, folks have been losing their jobs. And if they've lost their health insurance, these are just some of the information and resources that might assist them in this period. Next slide. When it comes to childcare, you'll see that there's a lot fewer resources that are available. One of the ones that is available is the National Children's Center for Rural and Agricultural Health and Safety and the Migrant Clinicians Network join forces and have a nice 5-page roadmap that talks about delivering childcare in agricultural communities. So how do you look at what the options are in your community and how to build out from there? I will say that this is probably one of the areas where we have the most opportunity to provide really good tools and techniques that have not yet been developed. So I would also really just encourage you, as you're maybe developing things and resources and tools, sharing them with Joy and myself, and we can also help disseminate those, because I think what we're really seeing is there's a real need for a learning community around this, so that we can really actively be sharing tools as they emerge.
All right, so that was all that we had for you today. We do have a couple of minutes left if you have any questions for us, but we really appreciate you attending and participating and offering your insight to how we can provide more resources in this area and how we can work together, like Shoshanah said, to really build some learning communities around this to benefit people throughout the state and beyond. So any questions?
And as you think, I did just post in a couple of links. So we do have a brief evaluation, so you can give some feedback on today's session and provide topics for the future. And then again, the link to our landing page for future sessions in this current series that's been announced. So please take some time to give us your feedback and check out what's coming up later on this year. But yeah, I'll turn it over to the floor for questions.
So I'll just say one other thing is that I think some of this work, it can be challenging for some of us with an extension, because the other issue is that it goes into a lot of values work, right? And a lot of times we're much more comfortable kind of talking about what does the budget look like, kind of seeming objective. But with both health insurance and childcare, we really need to have people talking about different roles in the family, right? What is it that we value? How much time do we want to spend with our kids? Who's going to be doing the work outside the home? Who's going to be doing the work inside the home? What types of work? And, I think it's okay to be honest and say that that's, sometimes we might feel like those are maybe barriers, right? In terms of being able to have those honest conversations with families, but that's also where this work needs to be done. So I really just want to say that I'm also excited to connect with all of you and hear your thoughts about how we can help create more tools and resources that will benefit you. But I'll stop talking. So.
Shoshana, I think you make a valid point about how that is values related, but I also think that anytime we can spin any of that value stuff into a financial bottom line, it's helpful to paint how that could impact later life decisions or current decisions for whether or not someone, for example, if somebody had to stay home to do childcare and couldn't continue to pursue their career and progress off the farm, what is that overall cost financially in the end, in terms of the whole family picture? To be able to put some of those emotions into numbers is probably helpful too.
I think one of our targets could be through, I just was recently certified as a facilitator for Annie's project, and starting maybe on the backside with that women in agriculture type. I think sometimes it's intimidating, and I know for the people I've worked with, sometimes it's that female counterpart in the household that is trying to handle that health insurance, especially in those, it's my sole farm income. And how do I don't even know what questions to ask. And every time I call to ask questions, it's an automated service. And I don't know the lingo and some of those things. And I think looking at that Women in Agriculture, that Annie's project and that side of risk, you could do your 6-week series, on the healthcare, childcare topic. And I think it would be very valuable. And I think an online version of that, because you can do things like the breakout sessions, is something to think about.
These are great. Thank you, Lisa and Sarah.
All right, it's sounding pretty quiet, and I have on my clock 10:02. So if you all have any other, questions, please be sure to reach out to Shoshanah or myself. I'm at rumble.6, and Shoshanah, you're at Inwood.2. That's what I thought. So please send us any of those resources or needs or ideas that you might have, and we would be happy to continue to work on this area together. So thank you so much for joining, and have a great day.
Thank you.
And thank you very much, Joy and Shoshanah, for your time and for your information today. We really appreciate it.